right there. So right in here again, so you can feel that part. Beautiful.
Holy cow.
You okay? What's going on?
It was good. I think it's just kind of knowing that I should have taken care of this a long time ago. So it brings you to having to do things like this to get, your body back to where it should be and your quality of life. It's an everyday struggle. It's an everyday battle. It keeps me up at night. I find that I'm taking, ibuprofen left and right. Oh!
It hits different when your mom cries too.
Yeah.
Yeah. It really does. Like, I've seen my mom cry, I'm like, I don't know what to do. I feel so, like, sad.
That's
how I just don't know. I was like, what do I do? I don't know. Like, more than anyone.
Well, because the moms are the strong ones, right? And we take everything in and...
So Cameron bought Wendy this visit because he was seeing that she was kind of rough.
Yeah, her lower back, her neck, she's been in pain a lot. So recently she's been complaining. So like I said, I watched your YouTube videos and I know what you've been doing. So I wanted to give my mom this gift from you.
So that's a good son.
So sweet.
Oh, Wendy, so your neck and your lower back, like you were saying, was hurting. So tell me the extent of it, how rough has it been, and how's it been impacting you?
It's an everyday struggle. It's an everyday battle. It's been keeping me from doing a lot of the activities that I love to do, whether it's, skiing, water skiing, it's yard work.
Yeah.
It's just the basic everyday at work, kind of having to find myself a little bit more in a sedentary position. It keeps me up at night. I find that I'm taking, ibuprofen left and right, which I don't like taking at all. So it's constantly having to move, because if I'm still for too long, it starts to set in and it's difficult to walk.
No, you've had other chiropractic experiences before, and they've been good.
Yes,
right?
correct.
This is just a question that kind of popped in mind. So you've been having this pain for the past 4 years now?
This started when I was 16 years old.
Well, okay, so
it's been a long time, but it's been exacerbating for probably 4 or 5 years now.
So if you had positive responses before, why didn't you ever decide to go back to a chiropractor?
Life got in the way, and I put my patients first, put myself on the back burner. It was just the time factor, I think. And I was always so nervous about going to someone new, because as growing up and seeing the same chiropractor for years, I felt comfortable with the staff, with the doctor himself, and I was young when I started with him. So for me, it was a comfort feeling, and it just, time got away from me, and it was hard to make it down to the office, as much as they were wanting me to for what was going on with me. I just couldn't, kids, work.
Yeah.
It all kind of, and then the time, you just don't realize how quickly it goes until you get older. And then it starts to set in.
And it starts to hurt more.
And now you find yourself feeling much older than you really are.
Yeah. So we want to make you feel like your age and younger. You don't need to live. You don't need to live in this type of pain.
No.
Right. So let's get you feeling better and make it more of a routine for you, so that you're not having to rely on the heating pads.
Yeah.
Because even though you have the heating pads and you're finding a way to manage your pain, it's not a solution. It's definitely not a long-term solution for you.
No, it's a Band-Aid.
Yeah.
Yeah.
So let's do it. Look straight. All right. Let's have you turn to the right.
My head?
Yeah. Any pain, tension, tightness there?
Tightness.
Okay. Where? At here or here?
Right down in here.
Okay. And look to the left. That a little tougher?
That's about as far as I can go.
Yeah. So obviously it's not great because your nose was right here, which is about 50 degrees. We should be closer to 90 this way. Look straight. Look all the way up to the ceiling. Does that hurt at all when you do that?
Yeah.
Okay. Where does it hurt?
Right at the base.
Okay.
Right up in here.
That's not normal, huh? Do you have any headaches, migraines, anything like that?
All the time.
Okay. So how When we say all the time, what are we talking about per week?
Oh, it's probably 5 a week. And now they're
Jeez.
starting to turn into actual migraines.
Go ahead and stand up now for me. Do you know what the normal amount of headaches per year are?
A lot less than what I got going on.
Yeah, around like 5 a year. A lot might be an understatement, so because you're getting 5 a week.
Yeah.
How long has that been going on for now?
That just started about, I'm going to say probably about 6 months ago.
Wow. Do you have a headache now?
Yes.
Okay. You're pretty chipper for having a headache. Let's try and touch your toes. Does that hurt at all when you do that?
No.
Okay. Come back up. And from there, stay right there. You're going to bend to the side this way.
Okay.
Does that hurt at all?
Yeah.
All right. Come back up. On the right side or left side?
On the left.
Okay. On the left. Okay. Go to the left side now. Does that hurt?
Yeah.
What side?
On the right.
On the right. Have a seat there for, actually go face down into the table.
Face down?
Yep.
Okay.
And let's have you do this. Keep that left leg straight. Lift it up as high as you can go for me. Lift it up. Good. Any pain when you do that?
No.
Okay, go back down. Do the right side. That's much easier on that side.
Yeah.
Okay. Sit back up again for me. So we're gonna go right in through here. She mean mugged me a lot too until the end. But she was okay with me afterwards. Kind of tough, huh? So this is a rib, and this rib's just kind of elevated. So we're gonna push in here so that we can help with that rotation. And then also here, you feel all these like rocks in here?
Yeah.
We don't like the rocks. Are you nervous?
No?
No, good. Turn your head all the way to the right. How's that feel now?
Good.
Yeah, look to the left.
Yeah, feels good.
Yeah, that's much better, right? So you went from 50 to like
Wow.
65, 70. So this is gonna be a little tougher.
Okay.
Okay. I'm basically jackhammering your neck so we can get some motion in it. Is this painful at all?
No.
Tender at all?
No.
Okay. I'm gonna push in there. I'm doing this to get and accentuate that curve back into your neck. So that curve in your neck, especially like with the stage, like you're around like stage 2 to 3.
Yeah.
It will take it around probably closer to like 8 months to 12 months for that curve to finally like return back. But it doesn't mean that you're gonna not feel relief before then. It just means that like you can feel relief even after just today. But in order to make sure that we're making the longevity type changes, that's really the time frame we're looking at.
Right.
All right. Look to the right one more time. Beautiful. Left. Beautiful. How's that feel?
Amazing. That felt great. That wasn't bad at all. No, that just, it felt good. The more pressure you put on it, the better it felt.
Whenever your body's finding that normal again, right? Because it wants to go back this way. That's when your body's like, oh, I kind of like that. That's nice. Right? Lay on your back.
He knows what's coming.
He knows what's coming.
Yeah.
And I think he's laughing because he's like, oh, you're in for something.
Yeah, I'm sure.
Yeah. But we are doing this because we see that her neck is just compressed. And because we see that her neck is just compressed. And we see that the discs are starting to deteriorate a lot. There's probably, instead of 100% in there, there's probably like 25, 30% left in those discs. So we want to get something to actually hydrate them back. And I'm going to place this around your neck. Okay. Have you seen this?
I have not.
Okay, so I'm going to place this and I'm just going to lightly pull. Keep your lips together, teeth together, and relax. Deep breath into your nose and out through your nose. You're okay. Good.
Oh.
Take your time. You okay? What's going on?
It was good.
What made you emotional? Like, what happened?
I think it's just kind of knowing that I should have taken care of this a long time ago. So it brings you to having to do things like this to get, your body back to where it should be and your quality of life. I think there was just like an initial shock And honestly, I felt it right back in here in the lumbar area. It didn't hurt at all. It was so quick.
That's the theme for most of the adjustments that we do. Is like you try to be quick with it so that you're not like anticipating it so much. But the major thing is that you are getting relief out of it.
Yeah. You know, I just kick myself for putting it off for so long. And I don't practice what I preach to my patients about taking care of their bodies, because the older we get, the quicker it breaks down. And you lose those times, you know, to really focus on yourself and the health, which is also, all of this equals up to your mental health as well, which is so important, and people forget about that.
How you feel physically, it's more than just the physical. It's the mental that happens with the long.
Absolutely.
We're gonna switch gears now. Let's have you go back on your stomach, okay? Let's try this again, okay? Keep the left leg straight and lift it up as high as you can go. Beautiful. How does that feel now?
Good.
How does that feel compared to the first time you did it?
Much better.
Good. And lift the right leg up. No, right? That's so good.
I was reaching for the ceiling on that one.
I thought your leg was about to pull out of its socket. Okay, so a couple things that we're noticing here is that we can see that on her feet, even just like in through her hips, this is kind of just pulled in like this, right? So you have this internal rotation happening on this left side, and then this external happening on that left side. We also do see that right side is just a tad bit shorter, even on the x-rays, but not that much. You can still see a little bit more pronounced on this way. So when I look at this, it's happening. This part is a little bit more of an issue than the other side. Let me see this here. Yeah, they're both kind of stiff. So what I'm gonna do, we're gonna actually pull out on this one first. Relax your hip more. Beautiful. So now afterwards, we can see that the hips just kind of turn a little bit easier. And then we're gonna go this way too. Let's relax here. Beautiful, that was even better. And let's try this again. Lift the left leg all the way up. Yeah, there we go. Right side. Yeah, okay.
Nice.
We're gonna start pushing right in through here, okay?
Okay.
So it's gonna pop up just like this, and I'm gonna start pushing down just like that. Good. Lift the left leg all the way out. Better.
Yeah.
Wow, it's a lot better.
Yeah.
And the right side. Yeah, good. I want to loosen you up a little bit here, okay?
Okay.
Good. How's that feeling when it goes down?
Feels good.
Feels like it's opening up a little bit more?
Yeah.
Good. So when I'm pressing in through here, I'm feeling so much tightness. Right into this mid back, yeah?
Yeah.
Right into this upper back, yeah. And then right, especially on both sides here, right into this right side.
Yeah.
Probably kind of even worse right there. So we're gonna have to release this and then come back. So there's a lot of tension, especially on these upper part of here.
Yeah.
Right in here and right in there I don't like. So chin up a tad, that's it. And let your neck just relax, let your whole body relax. And I'm just seeing where and how it wants to move. So we're giving little impulses just to kind of see. That's great. That was more like a shift. It wasn't even like a crack. It was like a whole global shift that just kind of pushed in. Now let's have you sit back up. Just like that. Perfect.
Okay.
How you doing?
Good.
Yeah?
Yeah. It kind of gets you a little, you know, when everything gets put back in place.
Hi.
Just kind of, you get your bearings again.
Yeah. Let me take this arm. And right in here, let me see the other one right underneath, just like that. Head down and slouch for me that way, yeah. So this is where we were feeling that. So actually I'm gonna go a little bit lower first for this part because her thoracic area just kind of extends out a little bit too far. Keep your head tucked just like that. And let your shoulders relax now. Let the head go down, better. Wow. You can sit back up.
Wow. Yeah, that was a lot. Sorry.
That's okay.
I expected it.
No, that was a lot. That was so much.
I felt great.
Yeah.
Yeah.
Phenomenal.
I felt good. Wow. Yeah, it's good. And I carry all my stress, I carry all my tension right here. It's always been, and I know when it's been rough because I swell up real tight, and then it's just hard every day.
So you got emotional, huh?
Yeah.
Yeah.
Yeah, I know. And I don't ever cry, so that was that was a lot.
Was that a shock for you too?
Yeah, it was kind of crazy seeing her facial expression at the end.
So let's go up a little higher.
Okay.
All right. Here, let me see this one underneath there, like that, head down. And we got a little bit earlier with this one, but I still want to come back into it. Drop the head down all the way. Good. Let the shoulders roll into the hand more. Yes. That was good.
Yeah. That's the exact spot that's just come about that's been bothering me so bad. Well, for years it's been the neck and it's been the lumbar. And when that appeared, I was like, okay, that just doesn't seem right. I never have really that issue there. So that was new.
I mean, whenever your neck's been so rough and it's been so much pain,
yeah.
I think the mid-back is the one that gets most neglected. And a lot of people will come in with neck and back pain,
right,
and not realize like it's that mid-back that's just holding everything tight.
Yeah.
Because this part just stays like this, especially if you're looking down, if you're in front of a computer, it's solidified. There's not meant to be a lot of movement in here.
Yeah.
But that small amount, like 5 degrees to the left and to the right, makes a huge difference for you. Let's have you sit up now. And I'm gonna check something here. I want you to look down for me. No, it's a lot better. Okay.
Yeah. Feels better.
Turn your head to the right and turn your head to the left. A little tougher to the left or to the right? To the left. Okay.
To the left.
Look straight. There we go. And we're gonna go this way and that way. So headaches. She's been having headaches five days a week.
Yeah.
That's not right. Neck pain constantly. Yeah, it could be your job. I'm not telling you to quit. Don't quit.
Yeah.
Yeah, so when I press right here, not so bad. When I press here, you see how like it's not wanting to move this way?
Yeah.
And I'm going to climb here. So what we're going to do is going to adjust this atlas on this left side. Because it's just popping out. That can really normally cause a lot of the headaches, a lot of the migraines. The fact that it is turning into migraines is not a good thing.
Yeah.
The fact that you've been neglecting this for the past 5 years is not a good thing either. But here we are. There we go. See where it stops. Right there is where we want to get. I'm going to get right underneath your ear. Lean back on my leg. And this one requires you just to really relax as much as you can. I'm going to try and get around your earring so I don't hurt your ears. But if I do, I'm sorry. All right there. So right in here again. So you can feel that part. Beautiful.
Holy cow. I was not expecting that. That was bad, huh?
Yeah, but you know, it was good at the same time. Because I'm glad because it moved well.
Yeah.
But I had a feeling that was going to be a little rough.
Yeah, I wasn't expecting that at all.
No. How's it feeling?
Feels good.
What does it feel like?
It's a little bit of like a dull sensation, I guess. A little bit of ringing, but it almost feels like there's this release of pressure that's just sort of escaping out. In all my years, I've never had that done, ever. But when you were rotating and finding sort of that range of motion, I could feel the tightness. I could feel that tension and the pain. You pressed right on it.
I would like to say I just felt it, but I did. I saw the x-rays. Yeah, so when I press here now and I press here, you see the difference?
Yeah.
Right? Way
that was
better.
super tight.
Let's check this again here, right? Now when we go there, it's much better.
Yeah.
Much here. So it's a little bit at this top part there. So when I press up in here, it's this little tender up top here.
Yeah.
Yep. So occipital area is what we're going to adjust next. Kind of the same way, but it's not the same because we're contacting different and we're making it go a different way.
Right.
All right. So lay on my leg just like that. And this one we are just letting this here. So I'm going to do a couple of tests on you just this way. Let your head bend with me. So there's not a lot of bend up top. So this bend up top doesn't happen. Try to loosen your jaw a little bit, and we can see that right in here. So I'm finding this spot that kind of moves.
Oh.
There.
That even hurt when you were pressing, like moving it.
Yeah, that's the headache part. right there.
Yeah, I'm not exaggerating when I say it was getting to be so many that I was like, okay, do I have a mass in there? Is there, something pressing on a nerve? Should I get a CT of the brain? That part is so uncommon for me, the migraines here and there, the sensitivity to light. That I've had over the years here and there. It's been super rare, but it's just all of a sudden it became so frequent that I thought there was something a little bit more on the clinical side.
Yeah.
That was concerning me.
I think the one thing that's like kind of sticks out to me is that if I just meeting you out there, I would have never thought it was this bad, right? At first I thought he just bought it because he just I didn't know, like, and I see it happen, like, oh, my mom needs it and whatnot.
Yeah.
Dude, kudos to you, man. I mean, seeing your mom this way and seeing how bad she was, because she hides it pretty well. Not pretty well, she hides it really well. Yeah. And seeing, like, being able to see that is something that a lot of people don't see unless you're really close to that person. And, it makes me tear up because it's something that I always want to make sure I'm taking care of my mother, no matter how much of a person she drives me up the wall. But I love her to death, and it's tough. Yeah. And you need it, and I think this is great because it makes you see, like, now I was effed up a little bit more than I thought I was. So this is it's a good realization, but it's also a good relief for you at the same time. Yeah. Let's do a couple more. Okay. I want to have you lay on your side and face towards Ken. So this one is a little bit shorter, remember? Not crazy, but enough to where whenever I'm looking at your legs, it does show up. Scoot forward this way more. Good. Here, let me see this arm, just like that. So I'm gonna call it untuck the butt. So now it's a little bit flatter there. And then I'm gonna have you just relax in through here. Turn your head that way. And we're just gonna let your hip roll with me. Just the hip, that's it. Just a little bit more. And then I'm gonna really roll you over a little bit. Good. So what I'm doing here is we're pressing in this part so you can feel that. Yeah. This is a good release in there. And we get to this tension point and we just roll a little bit and just a nice little quick motion. Easy.
Yeah. That was, as you were rolling it, I could really feel the strain in that area.
It wanted to go that way, but it just couldn't. Yeah. Good. How did that feel? Good. Good? Lay on this side. This one's a little bit different. Let the head here, go right here, head back a little bit. Just like that. Okay. Tucking. So L5, I'm really gonna really roll you over. Because we're having to push in this way. Let your stomach loosen. You can feel it's already popping, yeah? There it goes.
Oh yeah. Yeah, that was the spot. Mm-hmm. Wow. That got it for sure. Yeah.
It's always funny to me because, like, I thought the first one was better. The second one, you're like, yeah, that was awesome. We're just gonna give you small things like this. Does that feel okay? Mm-hmm. Yeah, just like that first stretch that we did. Mm-hmm. We're trying to open everything up a little bit. That's it. Deep breath in through your nose, out through your mouth this time. Let the neck looser. It's still a little too tight. Interlock your fingers for me. Better.
Oh! I made sound on that, didn't I?
You did.
Wow. That went all the way down. Mm-hmm. Oh, all the way down. Yeah.
I feel like she's trying to catch her breath right now.
Was that? Oh, that was the best yet. Kind of shakes your legs. Mm-hmm.
Kind of makes everything just kind of open up again.
It does. It makes you shake all throughout your body. Mm-hmm. Gosh, you just don't realize how much of just every little section of your body has an effect. That just, they're domino effects, right? Yeah. I mean, it goes all throughout. Wow. Okay.
This is good. This is a good energy.
Yeah.
Let's you up. I'm gonna bring this here. How does this feel now?
Amazing.
It seems like you're processing everything right now.
Yeah.
What's the immediate thought right now? What's kind of just rummaging through your head?
Relief. You know, you start to think, okay, how will I feel tonight? You know, with going home and just doing certain things, or tomorrow when you're at work, you're kind of just going through your everyday activities of, will I be able to feel better doing this or, you know, doing that? I'm a big believer in it. 1000%. And I preach to everyone, you know, about it. And of course, whatever you can do without surgery.
Sure.
Right?
Exactly.
Because, I mean, you really have to think about, and a lot of patients don't understand, you know, the after effects of that.
It's huge.
Yeah. I mean, it's in the recovery time and the downtime. And that's what I don't want to get to, because I'm not one that sits still for a minute.
I couldn't see you just kind of sitting still and being just like sedentary. I think it would kill you in a sense, just because you just don't seem like that type of person.
No, not at all. I'm on the go constantly, every minute of every day. So having that inner health plus, you know, the out is crucial to just who I am. And because there is no settling per se.
Right.
So, and I have a lot of life to live, I hope.
You do. You do. You do.
So I'm hoping
I believe you do.
This will help.
Let's recheck here. Look straight towards Kevin. Look to the right. It's like 100%. Look to the left.
Oh, that feels so good.
That's 100% too. Go to the side there. Look straight there for me. Look all the way up to the ceiling. That's great.
Sorry. That was kind of effortless.
Yeah.
I haven't been able to do that in years. Yeah.
That's amazing.
Go to the side. Can I test this out?
Let's hold it. Go to the back there, Kevin, and drop down to the right side.
More excited than you, I think. Oh my gosh.
Go to the other side.
It's been years since I could do that.
Good. And then turn this way.
Okay, I'm sorry.
This is normal.
Yeah.
I just want you to feel like this is what normal is. This is not, this is what you're supposed to feel.
There's been nothing normal about this for a long time. So yeah.
Come back once a month, get adjusted, and after 6 months we'll re-x-ray you. So this is the chance for you to practice what you're preaching.
Yeah, I know. I got to be the patient for once, right?
You'll enjoy feeling normal again. Yeah. Just think about like how you felt in the past. One visit in the past 4 to 5 years has just taken away a lot of that pain.
I know.
And just think about how you'd be in the next visit after that, and then just continuing. It's like I want you to feel good to be your normal, not you to feel bad to be your normal.
Yeah.
Well, thank you for coming. Yeah.
Thank you.
I appreciate it. Yeah, you did so good.
Oh, thank you. I appreciate everything.
Absolutely.
You were amazing.
Thank you. I'm just glad we're able to help you. And thank you, man. Awesome.
No,
Yeah.
A big change.
He was more excited than I was.
Because it's out of your norm, you know? You're just like, I have all this other stuff I gotta do. You think about it.
I'll get to it. I'll get there. I'll do it. And procrastination is, you know, our biggest issue a lot.
It's mine, definitely.